A fundamental foundation of our Canadian democracy is that we must be able to trust our government and major institutions to tell us the truth. If critical and consequential mistakes were made by those in authority, wouldn't you want to know? What have Pfizer, Moderna, Health Canada, and public health officials told Canadians about the safety of the COVID-19 vaccines for pregnant and breastfeeding women? Let's start at the beginning, the confidential contract between Pfizer and the Canadian government, the contents of which were eventually obtained through Freedom of Information requests from around the world. Canada's contract with Pfizer was signed on October 26, 2020, by our Minister of Public Services and Procurement, Anita Anand. But what assurances did the contract contain? At the time of signing, the Government of Canada agreed to accept Pfizer's conditions, including that the components of the vaccine were rapidly developed in the context of an emergency, and that the vaccine would require further study after its release. By signing the Pfizer contract, our government also acknowledged that the long-term effects, efficacy, and adverse effects of the vaccine were not known. Both Pfizer and Moderna provided the Canadian government with their own drug monographs, which provide their own claims, indications, and usage of these novel mRNA products. What did the Pfizer and Moderna monographs say in 2021 in relation specifically to pregnant and breastfeeding women? In early 2021, the Pfizer monograph made no claims about the safety and effectiveness of their COVID-19 vaccines in pregnant and breastfeeding women. They also made no safety and efficacy claims in children under 16 years of age, important for women whose breast milk might carry the vaccine product to their young infant, a factor yet unknown in 2021. The Moderna monograph, under a title of Warnings and Precautions, has the same disclaimer as Pfizer, that Moderna does not make any safety or efficacy claims with respect to their product in pregnant or breastfeeding women, or safety claims in children. They make the additional claim that it is unknown if the Moderna vaccine is excreted in human milk, and then go on to say, quote, "A risk to infants cannot be excluded," unquote.
For the vaccine clinical trials, didn't include pregnant women, certainly these initial clinical trials. But there's no biological reason why the vaccine wouldn't be effective and safe during pregnancy. The National Advisory Committee on Immunization has also said, look, we know that the clinical trials didn't include this group, but you should offer it.
There's lots of good data now that supports they are safe and effective in pregnancy.
There is good safety data so far with the vaccines in pregnancy, and no reason to believe that we will see concerns, particularly related to pregnancy.
In July 2021, Health Canada and the Public Health Agency of Canada tweeted, quote, "Evidence shows that it's safe for people who are pregnant or breastfeeding to get an mRNA COVID vaccine," unquote. But what was the Pfizer monograph telling us in June 2021, just a month earlier? The messaging had not changed. Quote, "The safety and efficacy of Pfizer-BioNTech COVID-19 vaccine in pregnant women have not yet been established, and it is unknown whether Pfizer-BioNTech COVID-19 vaccine is excreted in human milk. A risk to newborns/infants cannot be excluded," unquote. So what were women being told by late 2021 and into 2022?
It is also safe. It has been tested. We are recommending that women who are pregnant do receive the vaccine for the protection of themselves, protection of their baby as well. And that is has been proven. It has been accepted by the Health Canada, by the World Health Organization, by the FDA. And this is something that we want to make sure that we can protect everyone. Women who are pregnant, it is entirely safe and recommended for them to receive the vaccine.
There's no reason to be worried about impacts on fertility from the COVID-19 vaccines. Theoretically, we're not worried about it. There's no reason that the reproductive system would be involved in the response to the vaccine. And we also have more than a year's worth of data that shows us that there's no association or concern on fertility and pregnancy outcomes from the COVID-19 vaccine.
While Canadians were being told that the COVID-19 mRNA vaccines were safe and effective for pregnant women in 2022, the updated March 2022 Pfizer and Moderna monographs did not make such claims around the safety and efficacy of these vaccines for pregnant and lactating women. But what is the most up-to-date messaging to Canadians from Health Canada in 2023? Has it changed based on real-world data? Well, members of Parliament in Canada are given the opportunity to ask questions of the government. Here is one of those questions about the safety of the mRNA vaccines in pregnant and breastfeeding women, which was answered by Health Canada and signed by the Minister of Health on December 13, 2023. Health Canada responded by stating, "None of the COVID-19 vaccine manufacturers sought indications for use in pregnant or lactating women, or submitted randomized controlled trials in pregnant or lactating women for regulatory evaluation. The product monographs included statements about the uncertainties related to pregnancy and lactation." Health Canada continues, "As indicated in the specific product monographs, it is noted that the safety and efficacy of these vaccines in pregnant women have not yet been established. No indication for use in pregnant or lactating women was sought by the vaccine sponsors or authorized by Health Canada." And the final statement from Health Canada is, quote, "Health Canada has not approved any safety claims with regard to pregnant and lactating women," unquote. As we have seen, public health officials, TV doctors, and politicians have repeatedly stated that the mRNA vaccines are safe for pregnant and lactating women, even though the Canadian Federal Minister of Health, in an official response to a member of Parliament in December 2023, confirmed that Health Canada and the manufacturers of the COVID-19 vaccines made no such safety claims.